Hello, everyone, and welcome back to another episode of the podcast series Healthy Heart with Dr. Rohit Sane. I'm your host and friend, Dr. Aman Kapoor, welcoming you back to another episode. Friends, first of all, let me thank you amazingly. Thank you very, very much for extensive, enthusiastic support to this podcast series. We have been following up with your questions. You got a lot of comments from you and really appreciate all of this. Thank you so much for this. Also, I'll be happy to share that our podcast series is now amongst the top 40 health podcasts in India. So kudos to all of you. Thank you very much to all of you and really appreciate your involvement. Now, in this today's episode, we are going to discuss about another important topic, interconnect between diabetes and heart disease. I welcome Dr. Rohit Sane. Sir, welcome back to this episode. Thank you for all the information that you're sharing with us in the series. Sir, in this series, today's question, we are going to discuss about diabetes and heart disease. India is becoming the center of world's diabetic cases with over 10 crore people who are currently expected to be diabetic. And also there is a massive rise in the number of heart patients in India. So Dr. Sane, please tell us one thing. There are two questions over here I would like you to guide us upon. One is, what is the interconnect between diabetes and heart disease? And the second question that has there is that will every diabetic patient become a heart patient? So these two questions are the ones we'll begin with. Over to you, Dr. Sane.
Okay, this is a beautiful question. I'll answer the second question first, that can every diabetic be a heart patient? There are a huge amount of surveys which clearly mention that nowadays every second diabetic has a tendency of becoming a heart patient. So once you are a diabetic, you should keep this in your mind, that either the eye or the kidney or the heart or the blood vessels, something or the other is going to get affected because of this diabetes. The earlier we reverse our diabetes, it's always better. So now the question comes in that how does this actual diabetes result into heart disease? So what do we need to understand is diabetes is nothing else but high blood sugar. If at all your blood sugar gets beyond a certain level, that it crosses the renal threshold and it comes out of the urine, then it is called as diabetes mellitus. Now, the question is very simple, that why does this blood sugar increase? The reason behind it is nothing else but two different types of diabetes have two different reasons. One is resulting due to lack of insulin, which is hardly about 5 to 10% of the total diabetic population that we have all over the globe. Out of those total diabetics, 5 to 10% are type 1, which are due to lack of insulin. While the second category of diabetes is due to hyperinsulinemia. There is a lot amount of insulin being produced. Now, why is it produced and all these things? We'll answer it in a different podcast. But right now we need to understand is the second category of patients, which is about 90 to 95% of population, which is due to hyperinsulinemia. There is a lot amount of insulin produced in the body and still the body is not able to utilize this sugar level inside your blood. Now, how will this lead to heart disease? There are n number of reasons which would help us to understand that how does this increased blood sugar would culminate into heart disease. The first most important thing is increase in the HbA1c level. HbA1c level, as we know, that the hemoglobin in your RBC, the red blood cells, have a typical level of carrying blood sugar onto it. These hemoglobin molecules have an affinity to the sugar molecule and both of them marry to each other, and every RBC, every hemoglobin will be able to carry about 6.5 to 7 molecules of sugar all over the body. Now, if at all this number of blood sugar attaching to this hemoglobin goes beyond 7, then we call them as a diabetic HbA1c, so that the HbA1c goes beyond 7 or 7.5 and so on. So whenever the HbA1c level increases, there is a clear tendency that increase in HbA1c by even 1% would lead to deleterious effects all over the body. It could affect the brain, resulting in a stroke. It could affect the blood vessels, resulting into thrombus formation, that is blood clot formation. It could result into damage to the microcirculation, leading to n number of other fatalities. It could lead to n number of things. So increase in HbA1c itself is so problematic that we should work on this HbA1c level and reduce it down below 6.5 as much as possible. As well, when this HbA1c increases, obviously the blood sugar has also increased. Now, increase in this blood sugar leads majorly to reduction in the elasticity of the blood vessels. As we all of us know that the blood vessels have to be elastic, and when they are elastic, they would cater to all the pressure that is being generated inside the body, either physical or psychological. But if the blood vessels are not elastic, they would tend to rupture, which would lead to blood clot formation, and that would lead to further deleterious effects. So the second most important thing is reduction in the elasticity of the blood vessels due to this blood sugar levels. Third, this blood sugar levels, whenever they increase the turbidity of the blood. Whenever the turbidity of the blood increases, obviously along with these non-elastic blood vessels and increase in the turbidity of this blood itself, now this is going to be a deadly combination, that the blood vessels have also lost their elasticity, as well as the turbidity of the blood has also increased, and now we are going to expect much of these bigger problems coming in the future. Along with that, this blood sugar has a strength to damage the internal lining of the blood vessel, which is called as endothelium. More the blood sugar increases in our blood, obviously the endothelium, which is a guarding principle inside the blood vessels, is going to get destroyed. More the amount of endothelium gets destroyed, the lining inside the blood vessel gets destroyed, it is going to attract more amount of inflammation, and that is going to lead to the formation of a plaque buildup, which we normally call it as a blockage formation. Along with this, the blood sugar increase also leads to increase in the triglyceride levels in the body. These triglyceride levels, which are free fatty acids flowing all over the body, these free fatty acids will again now add to the problem that is happening because of high blood sugar. So along with this triglyceride level, there would be increase in the LDL and the cholesterol levels also, which is again going to add up into the fatty buildup inside the blood vessel wall. So all of these together is going to be a very, very deadly combination, which is going to damage the tiny blood vessels as well as the big blood vessels, which will affect the major circulation as well as the micro circulation, which is going to again create a problem in the future, because if a blood clot is formed and that leads to a heart attack inside the body, this micro circulation is the one which helps through the coronary collateral circulation, which helps the body to sustain against a heart attack. But due to diabetes, if at all these tiny blood vessels which form the microcirculation get obstructed because of these above factors which I just mentioned, this is going to invite problems. So the best solution on this, if at all we want to keep our blood vessels safe and prevent ourselves from an incoming heart disease, we are supposed to keep our blood sugar well back in control, keep our HbA1c well back in control, and this is not so difficult. Just with certain lifestyle modification hacks, we can control our blood sugar for the whole life. We can reduce down this hyperinsulinemia in our body, which is again going to help you to keep your blood sugar back in control, and for the whole life you could be absolutely disease free with a beautiful quality of life just by reversing your blood sugar back towards normal. So yes, diabetes leads to heart disease, but diabetes reversal can reverse your heart disease also.
So, Dr. Sane, thank you so much for those insights. Now, the important thing that we can understand from what you have said is that first, you need to keep your HbA1c under control. Now, to know your HbA1c, yes, if the person is diabetic, they would definitely be doing their HbA1c checkups regularly. But for a common person, many situations arise that people don't come to know that they are diabetic till it is too late, till a lot of symptoms start showing up. Now, to a layman who doesn't have much understanding, can you please guide us how to diagnose diabetes early as a layman? What symptoms or what should be the trigger for them to think about checking for diabetes?
Okay. It is not so difficult to diagnose diabetes. There are n number of symptoms, there are n number of signs which can be identified by the patient themselves. As well, the simple blood test nowadays, which hardly cost peanuts, can be done regularly by individuals who are at high risk of being diabetics. And if at all this has been helped on by creating awareness through such podcasts, I think we should be diabetes free in some coming years, because that is not so difficult. Now, coming down to your question that how would a person identify whether he is a diabetic or not, there could be a lot amount of symptoms that one should be looking out for. Like for example, first is going to be malaise. People normally say that I get tired with very less amount of work that I do. Early in the morning when I get up, the amount of freshness that one should expect, if at all that is lacking, you should think about high blood sugar. That is the first symptom that everybody should think about. Secondly, it is going to be the tendency of getting to pass urination in the night sleep. Many a times the patient has to wake up in the night itself and go on to pass urine. If at all that is a symptom which is coming on and off with you, then you are supposed to check your blood sugar as soon as possible. The third most important symptom which patients normally don't try to give a good amount of attention is having cramps in their calf muscles, and that is majorly in the sleep time itself. So many a times in the night a patient gets up complaining of cramps in his lower limbs, complaining of cramps in the calf muscles. This is a typical symptom that anybody can think of. If at all anybody has to be a diabetic, if these symptoms come up, check out your blood sugar. Along with that, there would be many more symptoms, like it could be something of tingling and numbness in the hands and feet, many a times burning sensation in the feet, many a times paresthesia in which the sensation is disrupted or something else has been felt. Many a times there could be symptoms with gastric disturbances. People would feel that they get constipated, they get bloated. Many a times they find laziness coming in as compared to their earlier days. So all these symptoms, if at all we talk about, if anybody feels up with these symptoms, they should check their blood sugar. If you find your blood sugar, the fasting blood sugar with 10 to 12 hours of fasting, if at all you find your blood sugar beyond 120 milligram per deciliter in the morning itself, that could be a diabetic zone. As well, if at all you find your postprandial, post-meal blood sugar beyond 140, 150, that can be a zone of being diabetic. Or else you can get a HbA1c done which doesn't need any kind of fasting. You can get your HbA1c done any time of the day, and if at all you find that HbA1c beyond 6.5, then you are in the zone of being a diabetic. So these are simple symptoms, simple signs, as well as the investigations that you can do to get yourself marked whether you are a diabetic or not.
Great, Dr. Sane. Now that comes to the next question. Once people have understood that diabetic tendency is there, they have checked, they've got the symptoms, and they've been diagnosed as type 2 diabetic. Then the journey starts of suffering from diabetes and having medicines lifelong. and slowly this progresses into causing heart problems also. But from what I know of Madhabag works on type 2 diabetes reversal. Diabetes can be reversed is what Madhabag says, and from what I know about Madhabag has reversed type 2 diabetes of more than 35 to 40,000 patients. So please give us an insight into how diabetes can be reversed.
100%. Diabetes can be reversed very, very easily if at all we get a good amount of compliance and adherence from the patient's side. Maximum time that you will need to see the difference in your own body, to see the changes, to see the improvement in your body, it would be max about 5 to 10 days as soon as you begin. So it's not such a demotivating journey, but I would rather say it is a very, very motivating journey, because you see the changes in your own body with these simple lifestyle hacks. I would give you 3 major things that you got to do to just keep your blood sugar back into control. The first principle that you got to do is have your meals very well defined, only max 3 times a day. If you reduce down it to 2 times a day, still better. But if at all you can't, have your meals maximum 3 times a day and nothing to be had in between these meals. You can have your tea, you can have your whatever drinks that you want to have, but during the meal itself. If you have these meals 3 times a day, first is going to be your breakfast, second is your lunch, and third is your dinner. If this is the first thing, if at all you do, to keep your meals well defined and only 3 times a day and nothing to be had in between these meals, the first point that you will see that the amount of malaise, the amount of tiredness that you feel will drop down very well, and you will feel much more energetic. So this is the first modification that you got to do. The second modification that you got to do is if you have more than 200 grams of vegetables, raw uncooked vegetables in the form of salads, if you have more than 200 grams of vegetables in a day, that will again help you to keep your blood sugar back into control. So that is going to be the second most important thing after the first. The first was 3 meals max a day. If at all you can reduce it down to 2 meals a day, still better, but 3 meals is okay. That is the first hack. Second is going to be having more than 200 grams of raw uncooked vegetables. Along with your cooked vegetables also you have it, no issues, but 200 grams minimum of raw uncooked vegetables is supposed to be had as the second most important thing to reduce down your blood sugar. And the third most important thing is all those drinks which are either made up of milk or made up of any sugar or sugar alternatives, all those food materials which are made up of milk, or else the drinks which are made up of milk, and all those food materials which have sugar or sugar alternative, if you can stop that to 0, your job is done. So these 3 typical steps, if you start following in your life from the first day itself, it could be a journey of 90 to about 180 days that you'll have to perform. And if at all you do that from the first, 5th or 10th day, you will find a drastic change in yourself, and you would see that the blood sugar has started dropping down, the HbA1c has started dropping down, and this is going to be a beautiful journey if at all you follow it for your whole life. So that is how you can just start embarking on this journey of diabetes reversal.
Thank you, Dr. Sane, for giving us that wonderful advice and giving us hope of diabetes reversal. Friends, before we conclude, there is an important point that you have to remember, that if you are diabetic, then your chances of becoming a heart patient are very high. And if you are already having a lifestyle that makes you prone to diabetes, then please start taking adequate care, adequate lifestyle changes in the way you eat, in the way you are physically active, in managing your stress, in doing everything that can keep you away from type 2 diabetes. Being type 2 diabetic becomes a one ticket that will take you towards the junction of heart disease. So if you want to stay heart disease free, keep yourself diabetes free. And if you are already a diabetic person, don't lose hope. Type 2 diabetes can be reversed type 2 diabetes reversal is definitely possible. We will be bringing about more details about type 2 diabetes reversal in our further episodes. And before we go, as always, remember, please comment on this post. Comment if you're on Spotify. Do share your questions in the section below. Share your comments. Feel free to write to us. Also, you can join our Facebook group by the same name, Healthy Heart with Dr. Rohit Sane. If you join this Facebook group, the link of that will be shared in the description. In the episode notes of this podcast, you'll find the link of the group over there. I would request you to join this group, and as always, follow this podcast, share this with everyone so that we all are aware of the right methods, the right lifestyle to keep ourselves healthy and happy. So till the next time, this is your friend and host Dr. Aman Kapoor signing over and out, thanking you all for joining in. Bye-bye.